and unfortunately, consent to the recording. Unfortunately, Jelly isn't able to be here to speak with us, but we are working really closely with Jelly and the Intersex Trust around this particular project. I will do a quick introduction for myself, and then I'll pass it over to Ada and Ahi. So my name is Angelo Lebeau. I am a transmasculine non-binary person. I've been working in the sexual violence sector for a number of years. I'm currently based in Tamaki Makaurau. I just moved up just before the lockdown, but before that I was working in Ōtepoti Dunedin with what used to be called Rape Crisis Dunedin, Ōtepoti Collective Against Sexual Abuse now. Now I'm the community liaison with Help Auckland. I'm also on the Paitaka Wainga for Te O Hake Hine National Network Ending Sexual Violence Together. And in that position, I'm the Rainbow Portfolio holder, which is a new portfolio that has only really just existed because we've been advocating for our communities. And I'm involved in a range of activity around sexual violence prevention specifically. And I'll hand it over to Ada before we start to talk about the project.
Kia ora, I'm Adeline Gregg. I work with Gender Minorities Aotearoa as a community liaison and also in resource development. I have quite a wide range of work that I do, and this is something that is particularly important to me. I guess I'll pass it to Ahi to introduce himself.
Kia ora koutou. I don't have a video for this one. So yeah, I'm the National Coordinator at Gender Minorities Aotearoa, and we're a national transgender organisation that is trans-led, and we do a really broad range of different types of work, including over 1,300 individual peer supports each year with trans people. We also work really extensively in a lot of policy and legislative spaces. And I guess that I feel like Adeline is underselling herself. She's done like a ridiculous amount of work this year on sexual violence prevention and family violence prevention, particularly with the government and things as well. It's very exciting to see trans women named as priority alongside other women when the statistics are, showing who is experiencing what and where those needs are. So that's me talking about myself. Hand it back to Angela.
So just for the purpose of this, we'll just do a quick rundown of what we already know about the sector. So obviously within Aotearoa, the family and sexual violence sectors, historically and continue presently to experience significant under-resourcing. So the sectors themselves are still running with not as much as they would need across all issues, across all communities. But they also have participated in the marginalisation and erasure of specific communities, including trans communities, Takatāpui communities, Māori communities, ethnic communities, a range of communities that are not seeing the results that we need from violence prevention efforts. So we have to address those issues in an intersecting way. So that's kind of what a lot of the sector has been trying to develop at the moment, is actually just really baseline starting to address the intersecting needs of survivors. Inclusion and leadership opportunities and safe working environments is still like a really significant issue for trans people in general across all kinds of areas of their work, but within the sexual violence and family violence sectors, particularly difficult because there's not a lot of people who are working in the sector who are part of those communities, let alone having leadership opportunities and resources attached to their work. The efforts that it takes to develop practice often relies on a really small handful of people, and as a community that already experiences disproportionate levels of violence, people with a sense of belonging to trans or non-binary or Takatāpui and intersex communities can also then be placed at increased risk of tokenization, harassment, burnout, and vicarious trauma due to the lack of support when working in these spaces. And that not only results in a sense of isolation for the individuals, but also fails to effectively sustain any community strategies to reduce such high rates of violence. So for me, as somebody who is working specifically within a sexual violence agency, it's really important for me just as an individual to be able to have peers that I can speak with. I've often been the only trans person in a space. There are times that I've been the only person of color in a space, the only ethnic person in a space. And that has been really stressful for me personally. And I can imagine that's the case for a lot of other people. And the impact that has then on the community is that our community aren't getting what they need. So we applied for some funding, which we were able to safeguard. The purpose of the funding specifically that we received through the Tindall Foundation is to support a holistic community development approach to the reduction of violence for trans, non-binary, Takatāpui and intersex populations. And so really we are invoking the core principles of collective action, human rights, inclusion, social justice and self-determination, which has been really important for this project, and the way that GMA and ITANs will work together, because we're being really mindful also that trans populations and intersex populations don't necessarily experience the same types of violence, but also the possibility that those populations overlap. And so we are also navigating how to work together. I'm just going to go really quickly through, this is not an ideal amount of time to talk to such a huge project in such a short amount of time. But I will just give a quick brief rundown for people that don't have or don't feel like they have like a strong theoretical knowledge of how prevention of violence works, but they're really practical reasons why it is important to have an understanding of how prevention of violence works. For a lot of people working in prevention, you think about violence as in primary prevention, secondary prevention, and tertiary prevention of violence. So primary prevention of violence will include things that are like universal and targeted interventions. So those are campaigns to promote safety, equality, and respect, strategic plans that change high-risk social settings for people that may experience higher levels of violence, promoting economic opportunities for trans, non-binary, Takatāpui, and intersex people, and just generally the work that lots of rainbow organizations and trans and intersex organizations are already doing to uplift our communities. That immediately shifts the social environment for our communities and is starting to reduce the levels of discrimination and harassment that we already face. Secondary prevention of violence. So that is really specific work. This is where it starts to intersect with crisis services. So those are things like training professionals who are working in spaces to improve crisis service responses to victims and survivors, early interventions for individuals who are at high risk of perpetration or victimization, systems advocacy to improve services for victims and services, victim survivors, and accessing a range of systems that they might need to when they have already experienced violence. So that is targeting medical systems, legal systems, mental health, and a range of other systems that people have to interact with when they may have experienced something. And then there's tertiary prevention efforts. So those are things like the long-term recovery services, support groups for people, provision of information about violence experiences in the workplace around domestic and sexual violences, targeted stopping violence programs. So there's kind of levels at which prevention efforts need to be targeted. And ultimately for us, that means that the areas that we need to engage with to effectively prevent violence, that includes education, healthcare, justice systems, mental health systems. There's such a huge scope for this work that it's going to be functionally impossible for a small group of people to ever do that. This is a collective, it needs collective action around this. I'm going to pass it over to Ada, because Ada in particular has been very involved with a lot of some of the work that we've done so far at AHI, to speak to some more specifics around what we've actually seen so far in this.
Yeah, so historically, we've seen huge deficits across all of these areas that Angela's been speaking to. Things like histories of exclusion, and even worse than that, there's barriers to change, there's burnout from people providing the services, there's a complete lack of specific training, a lack of specialist services, and a lack of any standard competency for trans, Irewhiti, Takatāpui, and intersex people. And this kind of thing's leading to obviously traumatization in daily life, including when accessing all kinds of services. And even as Angela noted, when people are providing services, they're experiencing traumatization, including re-traumatization around things that might have happened in other parts of their life. So we've been looking for consistent themes and sustainable solutions to this kind of thing. With all of that in mind, the scope of the work that's going to be required to facilitate such wide-ranging change is really expansive, requires a coordinated, collaborative, and sustainable approach. The area of violence prevention for trans, non-binary, Takatāpui and intersex populations also requires the involvement of people who have a really deep understanding of the current landscape and the issues currently faced by people who often have specific and multiple barriers in gaining access to safe responses that are going to be relevant to their circumstances. Also, people who identify with these communities aren't a homogenous group. These specific populations that are understood sometimes to fall under gender diverse, as it sometimes gets used, also often have very specific needs and barriers that must be addressed in those communities' own specific ways. It's really not possible to address this stuff without those respective voices all being involved in articulating what needs to happen next and being empowered to be actively involved in that delivery of these results as well. So the kinds of things we've been involved in so far, we've been starting a literature review, we've been looking at the research that does exist. We've also been continuing relationship building with people within the sector, and part of what's helping with that is the Rainbow Violence Prevention Network, which we also both sit on, which is a broader rainbow rather than trans and intersex specific organization. And we've been able to be involved in work such as Ahi mentioned earlier around the National Strategy for Sexual Violence by the Joint Venture Business Unit, which is across multiple different government agencies. So a lot of it is about trying to build the foundation to be moving forward to try and have those both high level and low level results in the long term. Is there anything that you'd add to that?
Yes. Ahi, did you have anything that you wanted to mention?
No, I guess, no, I think that you're covering it really well. I guess I would just say about the RVPN, it's sort of the key group working on rainbow experiences of violence in this country. So it includes, including like sexual and family violence experienced by disabled people, ethnic minority, multiply marginalized rainbow populations. It's a very holistic group that is covering a lot of stuff, and it's a collective of lots of different rainbow organizations working together. So yeah, that's all.
I just wanted to mention also that like all of this work has so far been not resourced at all. So this is like a huge, to this end, our collaboration has been voluntary. There's a reason why we are working together, because violence doesn't happen in a vacuum. It happens within a specific environment where there are specific dynamics going on, and there are social determinants of health that are associated with people's experiences of violence, which is why we need to be able to collaborate. This particular project, though, is focused on trans, non-binary, intersex, and Takatāpui people. So this stream of work is not all rainbow people. This is specific to a population group. You go for it.
So I'd just say that we're really glad that we were able to secure money for funding for that specifically, because we see that a lot of the time the services that are provided for rainbow people aren't addressing those specificities of some of those communities that might be seen as falling within that. And in fact, there are intersex people who aren't within the rainbow community or the trans community, and it's great that we have the ability to work on this in a organized way to achieve something great.
While there are lots of conversations happening in the moment, so I'm not sure where people are, just because a lot of stuff that government does is not very accessible for people, but there was advertising around the national strategy. One of the goals of the national strategy to eliminate violence is to start to connect the work that different ministries are doing. So what corrections are doing, what the police are doing, what ACC is doing, what education is doing, what the Ministry of Health are doing. All of those ministries, and there are more, have a vested interest in what is happening for people who have experienced violence, because there's just like a lot of silos happening at the moment. So they're trying to pull together the points of connection. And so what we're trying to do as a community then is like figure out what's happening at all these different levels so that we can respond appropriately. This is really the start of this project. The work that goes into these kinds of strategies it's generational work. So we don't see this as a thing where we're going to go, okay, well, let's start up this project. We'll slap some money on it. You know, within 6 months, we'll have this outcome. That's just not realistic. That's not what we see. It's not a sustainable way to plan for this kind of work. Te Hao Tangata, which was the national strategy developed by Takatāpui for eliminating violence, that the vision for that strategy is it's 2040. So we're really looking like long term. This project that we're talking about right now, we've safeguarded some funding for over the next couple of years to do this sustainably. So I don't want people to feel like they're missing out on something that is just starting now, really. In terms of invitations to collaborate, Ada, did you want to raise what people might be able to do at this stage?
Well, we're happy to see any literature you want to post in maybe in the community section on Hoover, or email genderminorities@gmail.com if you have specific knowledge in this specific area and could share that with us. And just be on the lookout for what we're doing, and yeah, think about pitching in.
We know that it's a lot to commit to. So I guess like for us, if you have an intersecting interest, if you're working in a space that has an intersection with people's experience of violence, we are interested to know if you are doing some work and how we can maybe work together and do some information sharing. But the space will develop as we go, and we're out of time, and I don't want to push Elizabeth out. So thank you for having us and allowing us to signpost.
Kia ora.
Good night.
Kia ora.